Good morning, Dr. West. Thank you for meeting with us and for sharing your research results with us. Could you now tell us about the implications?
Absolutely, it's my pleasure. As we're facing a reforming healthcare system, there's a lot of interest in providing improved care for patients with mental illnesses. And one of the primary models to do that is a health home. The concept of a health home is to provide comprehensive, coordinated care that's patient-centered. And also a goal of that model is to provide, in providing those services, there's a hope that also costs of care can be also contained. So in order to develop those models, it's important to understand those patients who are most vulnerable and at risk for intensive services utilization. So our data basically highlighted those patients looking at a large Medicaid sample from 10 states. And what our goals were is to characterize the clinical characteristics of those patients who are at high risk for intensive service utilizations, as well as other factors to identify patients in terms of providing improved patient-centered care. And basically we'd found that patients with schizophrenia or psychotic symptoms, patients with substance use disorders or substance use symptoms, and patients with violent or suicidal ideation or behavior were at particularly high risk for intensive service utilization. And importantly, when you look at the patients and see their disproportionate use, you can see kind of the value of focusing on those groups, for example, and providing better quality care. So patients with schizophrenia or psychotic symptoms, moderate to severe psychotic symptoms, represented 37% of the total Medicaid sample in our study, but they used approximately 3/4 of all hospital days. And patients with violent ideation or behavior, they represented 17% of the total sample, but used approximately half of all hospital days. So those are just two subgroups, for example, that could be focused on in terms of providing more comprehensive, coordinated care and services to meet their needs that could also help offset intensive services use. We also found that patients who were homeless or incarcerated had very high risk and disproportionate service use. And patients who were, who presented in hospital settings also presented in emergency department settings, indicating that those transitions to care could also, if they were managed perhaps more effectively, could also help in terms of minimizing costs and providing better care for these patients.
Your comments were very valuable, and I thank you so much.